The growth curve for the 21st century is a new international growth reference for children from birth to 5 years of age. These curves reflect the growth of children living in healthy environments who are fed following guidelines that promote optimal growth in infancy and early childhood. To develop this growth reference, the World Health Organization conducted a multi-center study of children from diverse ethnic backgrounds living in different countries around the world. In each country, one group of infants was measured several times from birth to age 24 months. Another group of children, 18 to 71 months of age, was measured only once in a cross-sectional study. The measurements taken are described in this video. The video was also used to help train field workers. Training was important to ensure that the measurements taken were accurate and reliable. The measurements taken in the study were weight, length, height, head circumference, mid-upper arm circumference, triceps skin fold, subscapular skin fold. A uniscale is used to measure weight. The scale weighs to the nearest 100 grams. To turn it on, cover the solar panel for just a second. After you uncover it, the number 0 should appear on the display. Infants and young children should be held by their mother. This provides security to the baby and allows measurement of the mother's weight. The scale should be placed on a hard horizontal surface so that the display is clearly visible. First, weigh the mother. She should wear clothing of a known weight, which is recorded and subtracted from the final weight. She should remove any heavy objects and take off her shoes. Her clothing should not cover the solar panel. Read and record her weight. Ask the mother to remain on the scale, then tar the scale by covering the solar panel. The scale is tarred when it displays a picture of a mother and baby. Give the baby to the mother. Ask her to stand still until the baby's weight appears on the display. To weigh a child older than 24 months, turn on the scale. Place his feet slightly apart in the center of the platform. Tell him to stand completely still. Record the weight as it appears on the display. Remove shoes and heavy objects. Stand still over the center. Record the weight in kilograms to the nearest 100 grams. To weigh an infant, tar the scale first. Length is measured on a Harpenden infantometer, which has a fixed headboard and movable footboard. To avoid causing discomfort, cover the board with a thin cloth or soft paper. The lead observer stands on the side so as to hold down the baby's legs with one hand and move the footboard with the other hand. The assisting observer stands at the headboard to help position the child's head. Braids should be undone and hair ornaments removed if they interfere with positioning the head. The assisting observer holds the child's head so that the top of the head touches the fixed headboard. To keep the child's head in the correct position, she gently cups her hands over the child's ears. The mother reassures the child and talks to her. The head is positioned so that a vertical line from the ear canal to the lower border of the eye socket is perpendicular to the horizontal board. This position is known as the Frankfurt vertical plane. The lead observer positions the child's trunk so that it is flat and straight on the board. Gentle pressure is applied on the knees to straighten the legs. The footboard is positioned against the child's feet, toes pointing upward. Measuring length can provoke anxiety and crying in children, so the mother should reassure the child. It may be necessary to keep the child's clothing on, but ensure that they do not get in the way of the measurement. Her head should be positioned correctly, and her legs and feet held firmly in their correct position to obtain an accurate measurement. You may wish to encourage the mother to take the time to comfort the child after the measurement. For newborns, position their head as you would an older child, but it is not possible to straighten the knees of newborns as with older children. Newborns are still very fragile and could easily be injured if too much pressure is applied to their legs, so the observer should apply minimum pressure on their knees. Position the head, straighten the child's trunk and legs, position their feet, then record the length in centimeters to the last completed 1 millimeter. A Harpenden stadiometer is used to measure height. The stadiometer has a vertical backboard, a fixed baseboard, and a movable headboard. In measuring child height, the assisting observer holds the child's legs to keep them straight and feet flat. The lead observer must get down to the level of the child's face. The child stands on the stadiometer with feet slightly apart. Hair ornaments should be removed. The back of her head, shoulder blades, buttocks, calves, and heels should touch the vertical board. Position the head so that the horizontal line connecting the upper ear opening and the lower edge of the eye socket runs parallel to the baseboard. This is the Frankfurt horizontal plane. Push in gently on her tummy to help the child stand to full height. Pull down the headboard to rest firmly on top of her head. Take the reading to the last completed 1 millimeter. Parental height is also measured. The subject stands centrally on the baseboard, her feet slightly apart, the trunk balanced over the waist, arms and shoulders relaxed. She looks straight ahead and holds her head in a Frankfurt horizontal plane. She takes a deep breath. This straightens her spine and gives a consistent measurement. Remove shoes and hair ornaments. Stand against the vertical backboard. Position the head. For adults, they should take a deep breath. For children, push in their tummy. Record the height in centimeters to the last completed 1 millimeter. A tape marked in centimeters and millimeters is used to measure head circumference. Hairpins or headbands should be removed and braids undone if they interfere with the positioning of the tape around the head. The lead observer stands or sits by the side of the child, passes the tape around the head and anchors it over the eyebrows. Check that the tape passes over the fullest part of the skull at the back. The assisting observer positions the tape correctly on the other side of the head. Pull tight to compress the hair and skin and take the reading to the last completed millimeter. An infant or child below age 2 years is held on the mother's lap. First loop the tape, then slip it over the head. Be careful not to pull the tape too tight and cause injury to newborns. Take care that the side of the tape marked in centimeters is on the outside for the reading, with the zero end in the superior position. Anchor the tape over the eyebrows. Pass the tape over the fullest part at the back of the head. Check the correct positioning. Pull tight, then record the head circumference in centimeters to the last completed 1 millimeter. The upper arm midpoint is determined for arm circumference and triceps skin fold measurements. In the growth reference study, these measurements were taken from 3 months of age onwards. The lead observer stands behind the child, locates the landmarks, and measures the length of the upper arm. He mentally divides the distance by 2 and calls out the value, which is the midpoint. The assisting observer makes a small horizontal mark over the midpoint before the tape is removed. The mid-upper arm point is half the distance between the acromion process and the olecranon. The acromion process is the most lateral bony protuberance of the back of the shoulder. Palpate the shoulder to find this point and mark it with a felt-tip pen or cosmetic pencil. Bend the child's forearms 90 degrees at the elbow, palm facing up, so that the olecranon stands out at the elbow. Place the 0 point of the tape on the mark over the acromion process and run the tape down the back of the arm to the tip of the elbow. Divide the distance between the acromion process and the olecranon by 2. This is the midpoint. Mark the midpoint, then remove the tape. Locate and mark the acromion process on the left shoulder. Bend the elbow at a right angle, palm facing up. Measure the distance from the mark to the tip of the elbow. Then mark the midpoint. The child's arm should hang in a relaxed position. The arm circumference comprises the skin, fat, muscle, and bone of the upper arm. Ensure that the muscle of the arm is not flexed or tightened. The tape should lie flat around the arm without compressing the skin or underlying tissue. Take this reading to the last completed 1 millimeter. The left arm hangs relaxed. Pass the tape over the midpoint. The tape touches the skin without compressing the tissues. Record the mid-upper arm circumference to the last completed 1 millimeter. Holtein calipers graded in millimeters with a precision of 0.2 millimeters are used to measure skin fold thicknesses. The calipers can look frightening to some children. Depending on the child's age, the observer may conceal the calipers or demonstrate that the instrument does not hurt. A skin fold comprises a double fold of skin and subcutaneous fat, but not the underlying muscle. To pick up a skin fold, open your thumb and forefinger 2 to 3 centimeters apart for young children and about 4 centimeters apart for older children. Grasp the skin fold gently to avoid causing unnecessary discomfort to the child. Fat is compressible, so the skin fold should not be shaken nor pulled out to meet the calipers. Open the caliper jaws fully and apply them at a right angle to the skin fold. The child stands unassisted or sits on the mother's lap with the left arm hanging relaxed at the side. Pick up the skin fold about 1 centimeter above the midpoint mark over the triceps muscle. The fold should run downwards along the midline of the back of the upper arm. Apply the caliper jaws to the skin fold at a right angle over the midpoint. Without releasing the skin fold, gently release the lever on the caliper handpiece. Wait 2 seconds and take the reading to the last completed 0.2 millimeters. Pick up the skin fold 1 centimeter above the midpoint. Apply the caliper at a right angle over the mark. Release the lever and wait 2 seconds. Take the reading to the last completed 0.2 millimeters. Gently push back and relax the child's shoulders with the child's back straight. Stand behind the child and palpate the back to locate the lower triangular tip of the shoulder blade. Put a mark over this site. Gently pick up the skin fold 1 centimeter above and medial to this mark. Apply the caliper jaws at a right angle over the mark without releasing the skin fold. The fold should run diagonally down towards the left elbow. Apply the caliper jaws at a right angle over the mark without releasing the skin fold. Wait 2 seconds and take the reading. Locate and mark the lower tip of the left subscapular. Pick up the skin fold 1 centimeter above and medial to the mark. Apply the caliper at a right angle over the mark. Release the lever and wait 2 seconds. Record the reading to the last completed 0.2 millimeters. Several quality control mechanisms were built into the growth reference study protocol. Before the study began, field workers at each site were trained and standardized to measure anthropometry. These standardization sessions were repeated every 2 months throughout the study. The sessions also helped to identify problems and take immediate corrective action, such as retraining if needed. Site visits were made yearly to ensure that the measurement procedures and techniques were standardized. All measurements were taken and recorded independently by 2 observers. One observer took all the measurements and recorded the values. Then the observers changed roles and the other observer repeated the same measurements and recorded his or her values. The 2 observers then compared their results. If the pairs of values fell within the allowable differences for that measure, no repeat measurements were needed. If any pair of values exceeded the allowable difference for a given measurement, each observer took a second independent reading, then compared the results. In this example, the difference in head circumference was more than 5.0 millimeters, so the 2 observers each had to repeat the head circumference measurement. Large differences between 2 observers' measurements could be the result of a faulty instrument, an uncooperative child, differences in the way 2 observers take measurements, and/or reading or recording incorrect values. It is important to use high-quality anthropometric instruments and necessary to use great care during transportation and storage. The instruments need to be assembled correctly and calibrated regularly. Move the footboard as far as it can go towards the fixed board. Compare the reading on the counter to the minimum value indicated on the board. Mark the minimum point on the calibration form. Place a calibration rod of known length along the middle of the vertical board of the infantometer and hold it straight. Move the footboard to touch the end of the rod and take the reading. Mark it on the calibration form. This process is repeated with each different length of calibration rod, and the reading is recorded. Length and height measuring equipments are non-calibrated if they are 3 millimeters off the mark. If the digital counter gives a clearly inaccurate reading, use a magnetic screwdriver to unfasten the screws that hold the counter in position. Slide the counter out of its case. Move the headboard to the lowest point along the horizontal board. Adjust the reading on the counter manually to the minimum indication on the instrument and turn the counter to the correct reading. double check that the reading is accurate and screw the counter down firmly. Move the headboard to the lowest point along the vertical piece. Compare that reading to the minimum value indicated on the back prop. Mark the minimum point on the calibration form. Then, stand a calibration rod of known length on the flat base of the stadiometer. Bring the headboard squarely over this rod and record the reading on the calibration form. This process is repeated with each different length of calibration rod, and the reading is recorded. If there is a disagreement at any of the known lengths, bring it to the attention of the supervisor. The surface of the scale should be clean. It is recommended that foot marks be pasted on the scale to indicate where subjects should stand. This will ensure that the subject's weight is evenly distributed on the scale. The temperature in the room where the scale is used should not exceed 45 degrees centigrade. The uniscale does not function properly at higher temperatures. In addition, there should be sufficient light to activate the solar panel. First, check that the value 0 is displayed after covering the solar panel for a fraction of a second. If it does, mark 0.0 on the calibration form. Successively weigh the test weights of 3.0, 5.0, 10.0, 20.0, and 28.0 kilograms and record the results on a calibration form. Tar the scale with the 20 kilogram test weight and weigh the 5 kilogram test weight. Record the result on the calibration form. Tar the scale again with an adult standing on it and weigh the 3 kilogram test weight. Again, record the result on the calibration form. If any of the recorded weights are different from the test weights, inform the supervisor. The uniscale cannot be calibrated in the field. It needs to be replaced in case of a problem. Check whether the needle indicates 0 millimeters when the caliper jaws are closed and mark down the reading on the calibration form. Inspect whether the needle moves smoothly and continuously with the opening of the caliper jaws. Test the calipers with the calibration block at 10, 20, and 30 millimeter test points and record the readings on a calibration form. The Holtein calipers have an adjustable dial that can be moved around to reset it if the needle has moved off the 0 mark. The fact that this can be done easily means that it will often move and should therefore be checked before every use. It is rare but not impossible for the calipers to go out of calibration. When checking calibration status, there may be slight variations in readings at different test points. No more than 0.2 millimeters, caused by the metal block's contraction and expansion in response to fluctuations in temperature. If the caliper is off by 0.5 millimeters, it needs to be replaced. If the needle sticks or moves jerkily, there's a plunger in the center of the rotary dial that should be oiled lightly to help the needle move smoothly again.